So, dear attendees, welcome to the webinar organized in collaboration with DHI Academy and London Hair Restoration Training Academy. We would like to inform you that webinar will be recorded for internal use. Your microphones will remain turned off to avoid any technical issues. You can share with us any queries or questions that you may have in the relevant chat room, where the manager will pass them to us in order to be answered. We would like also to inform you that we will be also in live broadcast with the social media. So, the aim of today's meeting is to present you the latest researches and developments in hair restoration, as well as the innovative projects related to the proper training of doctors. We are very honored that we have among us distinguished scientists and professors who, with their knowledge, will help us to move one step closer to the future. Not many people in the world are even aware how important our mission is to contribute to the health and well-being of millions of patients that suffers from hair and scalp disorders through proper education and strict protocols. Only one man showed the lack of the science in this field. So, dear attendees, kindly introduce you the father of hair restoration, the man that saw and innovated the future, the founder of DHI Global Medical Group, Mr. Konstantinos Giotis. Mr. Giotis? Mr. Giotis, I don't think that he is in. Costa, can you give me just a feedback?
Can you hear me now?
Yeah.
Okay, great. Okay. No, I was saying, am I the father or the grandfather?
You choose.
Okay. Okay, thank you, Angelo. This meeting is actually to present the latest innovations in hair restoration. And it is focused on safety, education, and regulation. I speak to many professors around the world about how important it is to regulate this amazing industry. One would expect for such an important industry, for such important treatments, that regulations would exist, but they do not. So we have taken the initiative, I would say, to work with universities and the authorities, both in the UK, in Greece, in Italy, and around the world, to introduce very strict protocols that they will regulate and they will ensure the safety. So that's, I think, the essence of this meeting. And the second part of our meeting today is to introduce you the latest innovations. What are the latest innovations in the diagnosis, treatment, and prevention of hair and scalp disorders? Because we all know that hair loss, it is a very important issue for thousands, for millions of people around the world. The first step to treat your patients, because we're speaking here to doctors from around the world, is the proper diagnosis. So today, for the first time, we will introduce the distance diagnostic program, a proper diagnostic program. Because, as we said many, many times, hair loss is a systemic, as Professor Lotti first introduced this idea from University of Florence and Rome, and he's here with us today. He says it's a systemic disorder and requires a systematic approach. So what is systematic approach is not just the idea of, as we said, safety, education, regulation, but to start with a proper diagnosis. So today we present you the proper diagnosis. Can we move on with the slides, Costa, to see some slides about the diagnosis? or which slide shall we see? No,
Yes, Andrea has the slides.
Okay, so yeah,
let's go from the first one.
Okay. So, Andrea, so the diagnosis is actually includes the three elements: psychology, dermatology, and trichology. So these specific protocols of diagnostic examinations must perform at every patient before they have any treatment. And I'm very happy to have with us, because we've been talking about psychology and psychology. Okay. Psychology is a very important part, not only the diagnosis, but also the treatment of our patients. And we have with us today Professor Labis Papageorgiou of the University of Athens, who is working with his team for 2 years now, I think it's more than 2 years, on a specific diagnostic and treatment plan relating to patients with hair and scalp disorders. Labis, are you with us? Can you please address the panel and the attendees about this project that you are introducing? Is Labis with us, Angela?
Yes, he's in. I think that Professor needs to unmute his microphone, so let's give him some minutes.
Okay. So yeah, we wait for Professor Papageorgiou to be able to connect and tell us about this program that we have started with DHI and the university that focuses on the psychological aspects of our patients. In the meantime, until Professor is connected, can you, Andrea, go to the how we do the diagnosis, maybe with a couple of slides to explain a bit more how these three elements are performed at DHI clinics?
Here we are, online diagnosis.
Okay, I cannot see it. How do I see it? How can I? Okay. Okay, so in diagnosis, again, we said we have to examine the psychological, the dermatological, and the trichological elements. Hair transplantation, for example, it is, in a way, the transfer, not the transfer specifically, but the redistribution, it's a better word, the redistribution of hair. When you redistribute the hair from donor area to recipient, what that really means in a way is that it's a mathematical act. We have to know exactly how many hairs we can redistribute, and of course, design this plan appropriately. So if you see here, this is why some measurements, specifically density and all this must be performed. That is the trichological and mathematical aspects. Let's go to the next slide, Andrea. Okay, here you can see in a very close-up photo how we are identifying not only the density of the hair follicles, but what we will discuss a bit later, and perhaps Professor Kotsarais from University of Pennsylvania will join us a bit later. It's his idea how can identify the anagen phase of every hair structure, but, and we'll talk about later, how to prolong the anagen phase. This is the key for those who are just starting to lose their hair, not 1 or 2, is how we'll be able to actually prolong the anagen phase. That's one of the main topics of today. And let's go back to the slides with the topics of today, Andrea, because I lost that.
Yes, I think that Professor Papageorgiou is also available.
Okay, we can go to Professor Papageorgiou because he will tell us a bit about his program on psychology and hair and scalp disorder. Labi, can you hear us?
Yes, I am present now and I am happy to be with you. Thank you, Kostas, for your very nice introduction. I must admit that you, in a sense, you have described in a very concise way and very didactic way the things which I was prepared to introduce to you. However, I try to say some introductory remarks about our very fruitful cooperation. It is well known that the psychological parameter participates decisively in the elicitation and maintenance of the skin disorders, especially the hair disorder and losses. And in this field, we have, as mentioned, a very productive and fruitful clinical and research cooperation with DHI. For this thing, I thank explicitly Dr. Giotis for this opportunity. And as mentioned, we try to participate both in the diagnostic level of analysis through questionnaires, to the introduction of the doctors about the parameters which are implicated in the idiopathogenesis of hair losses, in order to be aware doctors in a very appropriate way, in order to involve and include this knowledge in their therapeutical relationship with patients. Parallel, we participate in the training of the doctors in order to invite the patients in the participation in the appropriate treatment, psychotherapeutical treatment, in a very simple way expressed, to manage in a very effective and efficient way the distress, which is the essential pathogenetic parameter for the elicitation, as mentioned, and maintenance of the hair disorder or hair losses. In addition, with this poor psychological level of analysis, we have included cognitive behavioral therapy treatment, and at this moment we are in the development of biofeedback methodology, which is promising in order to help the patients to control more effective their distress. And we also include, and is a very also promising parameter, the registration of anosological and biochemical mechanisms which are related to the skin disorders and hair losses, such as the parameters which are in association with the cannabinoid system. That's the things which were prepared in this limited time to present to yourself. Thank you for your attention.
Thank you very much, Labis. I would ask you one simple question, though, for everybody to understand, because in this meeting, for the first time, we'll have patients and doctors participating. The reason we do that is because we want the patients to know as much as possible. And you're saying that the distress and distress, do you think that the treatments that we offer, let's say DHI and other doctors, that will reduce their stress, and can this be measured?
We have the ability through questionnaires and psychophysiological devices to measure and assess this parameter. About your hint regarding the possible therapeutical consequences of the psychological perspective, I am obliged to invite all of us to think about the placebo effect in order to bring in our mind the parameters which are in every human being, which through particular therapeutical approach could be freed, and we can an alliance with this very useful natural parameter.
Thank you very much, Labi, and we're looking forward to introduce in September more details of this, let's say, psychological support program we offer, which I think, from what I understand, is going to be also offered online as part of the diagnostic distance program.
Thank you, Kostas. We are intensively prepared to be ready to present this very promising capacity regarding the diagnosis and treatment of the patients.
Thank you very much, Labi. We look forward to it. Let's now move to the next part. We briefly described the psychological element because, as we said before, hair is an indicator of good health. In a way, it's an extension of the skin. People don't realize that hair is part of the skin. Hair quality actually reflects a person's physical health. So it's an overall thing. And trichology, this is what is, we keep talking about diagnosis. Trichology is the diagnosis and treatment of diseases and disorders of the human hair and scalp. So that's the new thing. How do we do the so-called trichology? How do we do the so-called psychology? And this is what the meeting is introducing. There are specific protocols and programs in place that trichology, dermatology, and psychology will be emphasized and will be performed at every patient. There are some types of hair loss which can have a natural or spontaneous recovery, which is also has to be examined as part of the system. Excessive hair loss, however, can often be a symptom of some other problems or a variation of metabolism of the body. And for this reason, you have to be very, very careful of this, all you doctors. This cooperation between patient, doctors, and the trichologist is often necessary and after the treatment. So let's move, Andrea, to the next slide about, again, a bit more information that you have on diagnosis. And then we move on to observe a live session. And of course, to listen to Professor Kotsarelis and to Professor Lotti when he connects to update us on these elements. And, or if you can go back to the topics again one more time before we go to diagnosis. Okay, so
Mr. Giotis,
yes.
I think that since we have Professor Mojalal and Professor Krasas with us, It's about a great opportunity to discuss about the dermatological part and for sure about the protocols that we teach and we train our doctors. What do you think? If they can just give us a brief.
Oui, Professor Krasa, bonsoir. Professor Mojalal, bonsoir.
Just give us a moment to allow them to unmute their...
Unmute them already.
Professor Casas and Professor Mojalal, they are professors of dermatology and plastic surgery in the University of Lyon, which is one of the few universities that offers a diploma course for doctors from around the world. And the DHI Academy is working in association with the University of Lyon. Professors?
Give us a moment.
Okay, until we're connected, Andrea, take us to the topics of the day again. Pinch out bigger view. Okay, you can see bigger view. Okay, so we briefly discuss the safety, the trichology, and psychology. We will now go to dermatology when the professors connect, and then we'll finish with the live session. And for the first time ever in the history of hair restoration, we're going to introduce the first distance virtual reality training program. So what do we see now, Andrea? I think we're viewing now.
We can see the video of the diagnosis.
Diagnosis. Okay, it's part of the diagnosis.
Okay.
In this case here, the patient actually is a doctor, is a DHI doctor, who had his diagnosis, and you can see here they're checking his donor area.
Okay.
And the doctor is himself having a session today.
Hello, how are you?
Hi Ali, bonsoir, ça va?
Bonsoir, how are you? This
is good to have you with us.
This is a great webinar. Thank you very much.
We just started some new ideas. So every month we're going to update everyone. So it's the beginning of, in a way, a new era.
Thank you very much.
So we hope to introduce...
Costas, you can take the opportunity. You can take the opportunity to finalize everything with Ali.
Yes. Thank you very much. Ali, are we ready to start the new program in University of Lyon, maybe from next season?
With pleasure, with pleasure, with pleasure.
That's great. Professor, just to let you know, we have so many doctors that they are interested to participate in your course. So it's going to be very interesting to have a short briefing about this course that we are going to establish in collaboration with London Academy.
Yes, you are all welcome. You are all welcome, especially all that has been through DHI program. You are all welcome to the university program.
And we'll now, I think we're going to talk about after the live session, we're going to introduce you to the virtual reality distance training program.
Great.
Which can also be, of course, in association with the University of Athens and University of Lyon, as we did before the hands-on programs.
Professor, to whom this course will be addressed? We have a question. Can someone with a biomedical science degree can also participate in this course?
Biomedical, is it an MD, medical doctor degree, or what is it exactly? Okay, biomedical science, what is it exactly?
Give us a moment to clarify, but please, in the meanwhile, can you please inform us to whom is this course addressed to?
Angela, it's mostly for doctors, mostly doctors only MD.
Mm-hmm.
Yeah, only MD.
Okay. And about the course outline?
About, sorry?
In hair restoration. So you're going to learn the protocols in hair restoration.
Yeah.
Yeah, with the DHI Academy, we're going to publish that probably in September. We have ready all the new additions to the existing program. So by September, we can publish that on the websites and, of course, send everybody the information. So shall we go to the live session, or is it too early, or shall we stay at the diagnostic part?
We can see some videos before we go to the live session. We can see some videos from direct hair redistribution, the extraction phase and the implantation phase, if you wish to.
Please, yeah. So what we see here is the hair transplantation, the extraction with a DHI. This is very important because we talk about safety, and safety is the diagnosis, correct? Number one. And number two is the technology we use. This punch that you see here, it's a motorized electric, mini motorized punch, and the whole thing, it's single use. Every instrument at the DHI technique is single use, the extractors and the implanters that you will see later. Single use, and the patient participates in signing a form that he verifies that they were actually destroyed in front of him. It's a very important safety measure that we had a long time before the coronavirus crisis. So any more videos are there? This is the extraction again. Do you have it in slow motion or in a...
Yes, we can see on slow motion now.
Okay. So all this training, all the things that we discussed today, including diagnosis and treatments, will be able to be, for doctors around the world, to be trained online on a distance program. And of course, the VR, the virtual reality that we'll show briefly after this, will be also part of this new unique, everything now is distance anyway, even before the crisis. So to stay with technology and medicine, now they go together, distance treatments, distance diagnosis. So here, slow motion of there. Can you make it a bit bigger?
Yes, we can.
Seems very simple, doesn't it? Okay, let's now go to next video. Here we'll see the loading of the implanter. And let's go to the next one. And here we'll see the placement on unshaven session. I think we have many doctors who are interested and they keep asking questions, how much and what is the duration of the course. Of course, they're good questions, but Angela, the administrator, will send you all the information, and you can also send the questions to info@dhiglobal.com. Okay, now here you see the implantation part with unshaven. It doesn't have to shave his hair. So where shall we go next? Is Professor Kotsarelli with us? Okay, is Professor Skandalakis with us? Is Professor Felipe Magistrati from Switzerland with us, or Ali Perez?
Professor Felipe is connected, yeah.
Go to Tofik Aliafi, famous plastic surgeon from KSA. Tawfiq, how are you? We will show your video in a minute. Let's show the video, Tawfiq. That's the video. A plastic surgeon himself has done a lot of research, and he decided to have a treatment. And let's look at the video.
Athens, or Athena as we say it and as the Greeks say it. I believe that the center here, or in Lavrio, which I've seen there as well, which is a beautiful area to be.
Oh, pure cleaning, yeah.
But yet the center clinic is an amazing clinic, full of energy, full of people all over the place, and a lot of excellent surgeons. This is why I think I chose to be here rather than anywhere else, even though it is affiliated by DHI. So I always recommend just coming to Athens. Okay.
And can we see the result in the session of Tawfiq?
It's now live actually, so maybe he can show it live to us the results.
Because we had one during his procedure, I think.
We have
Hi.
Hi, Tawfiq.
Hi, how are you? I had to park my car to join. Hi, everyone. It's a great pleasure to join this webinar, and special thanks to my dear friend Costa. I've been dealing with DHI, 17 years now, sending clients, top VIP clients to DHI. Most, I think it's all, but let's say most, with very pleased results. And I decided to do it myself. The first session I had, I think it was February 2017 or something, and then I had an invitation by Dr. Yotis to come and do touch-ups, even though I thought I didn't need it, but I'm glad I did the touch-up as well, because my hairline, I think if everybody can see here, I think I have good hairline and excellent hair volume. So thanks a lot to all of you.
Thank you, Tawfiq. And also would like to ask you, because you have spoke to many patients, and we today emphasize the psychological aspects of hair loss. Do your patients are willing, open to discuss the psychology, or how? Because every, let's say, country or every part of the world is a bit different when it comes to psychology, especially about psychology and hair. Do you find this challenging, or is it easy for you to communicate that, yes, we need to also check your psychology? What do you think?
I think our part of the world is still a bit conservative compared to the rest of the world. However, now with the younger generations, they're more open into discussion and giving their real feelings. And as you know, I was one of the people who thought that my self-esteem actually has improved a lot with the hair transplantation. So
really?
Yeah, oh, definitely, most definitely. I always tell my wife and my close friends that this is something I did for myself, and I was very happy that I did it, and I continue to be very happy that I did it. And I would strongly advise all my colleagues, either my age or younger age or even older age. I think it does improve the self-esteem, the quality of life. I think it's a great invention, simply.
Thank you so much, Tawfiq. And now we'll go from Riyadh to Pennsylvania, USA, to listen or to talk with Professor George Kocharelis, who I think will talk us more about the future than the present or past. George, it's a great pleasure to have with us again.
Hi, nice to join you again for a little bit. I was wondering if I could share my screen.
Costa, my professor.
One moment, we will allow this. Okay, you can share now.
Okay, George, I think now you can share your screen. Okay, now we can see it, yes.
Okay. Can you hear me?
Yes.
Okay. You had titled the session that I was going to talk about a little bit, anagen prolongation.
Mm-hmm.
And, you know, that is a major goal in hair and treatment of alopecia, and certainly hair restoration. If you transplant those follicles, you want to keep them in anagen. And if you can prolong anagen, that has a hugely beneficial effect, because if you look at a terminal follicle compared to a miniaturized one, the duration of anagen is markedly reduced, going from years to really days to weeks. And so in thinking about this, it really is important to understand the hair cycle and what controls the different stages of the hair cycle.
Mm-hmm.
So we know that in anagen, the hair grows, and then in catagen, the growth stops. And if the reason this is important is because if you were able to keep a follicle in anagen forever, you would never lose hair, right? And it would never miniaturize, because miniaturization happens when the follicle cycles. So it has to go back in from a resting stage to a growing stage, and that's an opportunity for it to miniaturize. So Headington showed this years ago, that if you could increase the duration of anagen, the number of hairs lost per day would go down dramatically. And that's why you don't lose much hair on the scalp. You have 120,000 follicles, you know, maybe 50 a day come out. So the only approach right now that we have is minoxidil. That is a known compound that prolongs anagen. Finasteride will also do that in men. And interestingly, bimatoprost in eyelashes. And so this prostaglandin pathway is one that we're studying at Penn, and finding that different prostaglandins have effects on the hair follicle. And I've identified different receptors that both prolong anagen, but also prevent anagen from being inhibited. So prostaglandin D2 is a type of prostaglandin that inhibits anagen. So by blocking the effect of that, you can prolong anagen. So looking into the future, I think that we'll see new products that target these different pathways. I'll stop there, actually.
So, George, do you think, because you said the 120,000 follicles, do you mean grafts, as we say in hair transplantation, or single hair shafts? Yeah,
single hair shaft. So, you know, it's a variable based on the race, but we use, you know, 100 to 130,000 as what's been published for the number of hair follicles on the entire scalp. And I know you think in terms of units, which is different.
Yes.
But in general, we want to prolong anagen in any type of, whether it's within a follicular unit or within an individual follicle.
And I know we discussed this before, that psychology does affect the duration of the anagen phase. Do you think what we're now working on, supporting the psychology of the patients, could somehow affect the cycle?
Yeah, there's interesting data about cortisol and the effects of stress on hair growth. Cortisol tends to prolong telogen. So if you're under a lot of stress and you have higher levels of cortisone, you may slow down the cycling, but in a way that prevents anagen. So you have follicles accumulating in telogen, and then you get a telogen effluvium. So definitely there's a correlation there. Whether we can take advantage of that and turn it into a benefit, you know, I think there's a path there that needs to be explored further, as I know some of your colleagues are doing. So it's definitely worth thinking about.
Yeah, as we said before, George, the path to extending or prolonging the anagen phase is much more near to us than the stem cells project.
Yeah, I think because pharmacologically you can manipulate anagen, so that requires a lot less maneuvering than growing cells and reconstituting hair follicles. That's more of a long-term project.
Thank you so much, Professor Kotsarailis.
All right, good to see everybody.
Great pleasure to have you with us.
Enjoy the meeting. Yep.
Thank you so much. So let's go to the live session, and then we will end with just a recap of what we said today. So we're very interested today. We had two doctors, Dr. Tawfiq Aliafi, who is also DHI patient, and now we're going to view a live session of direct hair distribution, the latest technology, with also a patient who is a doctor himself. Until we connect, there we are. Okay.
Can you hear me, everybody?
Yes, we can hear you, doctor.
Great. Well, the whole procedure is a fantastic experience. It's painless. I feel nothing. I have no blood, as far as I know. The doctor is amazing. She's doing her best. And I have to thank DHI for the perfect protocols that make this whole procedure so pleasant. And I would do this anytime.
You make it sound like it's fun.
Yeah, I feel first of all, I feel really happy that I'm correcting my hairline from my previous time that wasn't very successful, as you see it.
Yeah, George, can you ask the doctor to go a bit slower so we can see the movements of the implantation? And that we're discussing here what we call hairline reconstruction.
Yeah.
Hairline reconstruction, both male and female, are very important, but they have to be performed precisely, both in angle, direction, depth, and distribution. And this is part of our distance learning program with the virtual reality, which we're going to introduce you next. And that will be the end of today's seminar. Can we see one more minute of the slow motion of this implantation?
Yeah, it's going great. I feel nothing.
Can we get a more close-up, George?
Yes.
Okay, this is the old famous DHI technique. I know I sound like a salesman, but maybe I am. Which, of course, everybody's trying to copy now. But this is the DHI technique, direct hair implantation. It can be done for hairline reconstruction. It can be done for the crown, the top. We do eyebrows, facial. There was one patient today, I don't know, maybe it's part of the group today. He said he wants to do hair transplant in the neck. So only doctors asked, why he wants to have hair transplant in the neck? So that would be the first one. We never done. Have we ever done neck transplant? Neck hair transplant, I mean. Andrea. Okay.
I think it's going to be the first time that we're going to have a neck hair transplant.
Yeah, I think there's never
if I'm not wrong, yes.
So, okay. So, yeah, we can see the movements here and the placement of the live session.
And let's not forget that this is the second hair transplant that the doctor is having. He had a strip surgery some years ago, okay?
I had a strip in the past, but as you can see, it wasn't very successful because it wasn't dense enough and it wasn't straight. The two sides were different. And also, it had a good test. Now it's going much better. I'm feeling much happier.
Yeah, the strip surgery, most of you know, we DHI stopped 15 years ago, and we introduced FUE, and then we introduced DHI Direct, which is the most advanced, and now we're doing the direct redistribution system, more of a single hair follicle, even more advanced. So yeah, thank you, George. Let's go to the, shall we go to virtual reality and close the meeting? Because I think it's been over an hour.
Of course.
No, we have 10 minutes, yeah. Okay.
Okay, so should we just inform you about this new project that our academy is keen to prepare? The simulation training is keen to prepare a virtual software that will assist us to achieve a faster and better training system for our doctors and our assistants. To be more specific, we will establish an animation modeling system with character deformations and rendering. This software will consist by a virtual reality scenario where a male bald patient with a provided animation for both sitting and laying down positions on VR session room, on a virtual reality session room. So through this program, our trainees will have the opportunity through this system to practice on bald animation patients. So we will prepare a complete virtual reality system with all the essential for the operation tools, such as mechanics development for the operations, for example, the head marking with virtual marker, local anesthesia, etc. So this software shall include time and scoring system with the implementation of errors and critical errors, as will be provided by our protocols. What are the benefits of simulation training? This is very important. Why we're trying to do that and why we're trying to establish this kind of software. First of all, it's to do the impossible, to have the safety first. Through the virtual reality training, this forces the trainees to get out of their seats and practice the learning objective. As the name implies, you're getting as close to real life training as possible. So the virtual reality will give you the ability to go beyond telling students what they will experience in the field and showing them steps. So that means that you have more safety for your patients and for our patients, of course. The second part is that there are more practical hands approach. The virtual reality training gives the ability to give to our trainees to exercise the first time and as many times as it takes for it to get it perfect before they ever do it in the real world. So they will feel that they work in a real surgical room environment with the necessary medical equipment. With this way, we can avoid serious mistakes and we can walk away from them. And the fourth reason that we would like to start is that we boost the learning retention. Of course, as you already know, as much of you are doctors, so you know that this is also the phobia therapy. We reduce the stress through this system. You can learn the technique as fast as you can avoid the mistakes, and then you will be ready to practice on a real environment. So this is the new program.
That was very helpful. So the virtual reality is the first ever program introduced in hair restoration, and it will be actually ready at the end of August for participants, and will be also associated with universities, so will be connected with your university diploma. So you see all this connected. Not only you'll be able to train distance, but part of the program will be an organized, let's say, instructions and training protocols and kit with all the necessary instruments needed. So this is all part of the training program, the distance program. And of course, the hands-on exists at DHI London, at Lyon University, and Art University, and hopefully with Professor Cucciarelli, we'll start the same program at the University of Pennsylvania in the next few months. So I think this is the end of the day. Thank you very much for attending. Attendees will receive DHI products at as a special discount price. Also, you receive a free copy of the book, Hair Loss, Balance Your Options, And this is the best part, 20% discount on all training and treatment programs. This is for doctors. They will get training discount programs, and the patients will receive 20% treatment program. Before I say goodbye, we have Dara from the UK, who is a DHI patient. It'll be good to see again a result, because everything we do is for the patient's well-being and health. So this is our mission. And here, let's listen to another patient. We heard one from Athens and one from Saudi Arabia. Let's hear one from the UK, so we can finish perhaps with some words from the patient himself. Hi, Dara, how are you?
Hey, Jay, how you doing?
Good.
Just basically speak about my experience and about what's happened and what everyone said today about my self-esteem. Massively improved once I had the second transplant. The first transplant I had was in London. It was only just a small one up the front, because I was receding quite young at like 21. And then it was last year, January last year, that I had the big one in Athens. And as you can see, I'm extremely happy with the density. And as you've seen there in the live stream, that it's totally pain-free. I couldn't be more happier with the job that DHI have done. And it's also, you know, improved my work for what I do, because I am an actor, and it's just improved my life all around.
That's very interesting, because Dr. Tofik Aliafi also mentioned that it has helped his self-esteem. Mm-hmm. And I think the way you're saying that psychology has improved within yourself after the treatment.
Yeah, 100%. You know, men. I find that men especially don't like to express how they feel when they lose their hair. It's almost like you know, like speaking of, say, knowing of my dad, that men wouldn't really speak about losing their hair, and maybe there was nothing then when he was losing his hair to do it. But I feel like, especially my generation and maybe younger, are starting to accept that you can now get something done and you don't have to be embarrassed about it. Anyone that I meet, I do tell them that I have had a hair transplant if the topic comes up. Yeah, self-esteem is massively improved.
Thank you very much, Dara. We hope to see you in a super movie one of these days.
Dara, we have a question for you.
Yeah, sure.
Did it hurt?
Not at all. No. It was very comfortable. You know, you're lying down on, like, I suppose what you call a masseuse chair, I guess is what it is. And there was nothing uncomfortable about it. You know, I remember being in there listening to whatever music I wanted to, and I also had Netflix on my phone to watch, so there was no pain at all.
That's cool. And what about the recovery time? Do you remember from your experience? And do you remember
pretty much? I mean, it depending on obviously the work that you do, but you could pretty much go back to work straight away. You know, I mean, you know, if you were to get it done on a Friday, you could take the weekend off and go back to work on a Monday. Yeah, it just obviously depending on you know, for me, for an actor, I prefer long hair, so I had to wait maybe a little bit longer just for my hair to grow back, but it grows back my hair grows pretty fast, so I was back working within a month. But that's because I'm an actor.
That's great. Thank you, Dara. Thank you.
No problem. Thank you.
There was a person here who was asking, during the recovery time, was there pain after the local anesthetics?
No, not that I can remember. Anyway, I'll just say a hard no right now. Nothing at all. Sleeping was fine. Yeah, no.
Thank you, Dara. Okay, let me just go over again what we discussed today. We discussed about safety and regulation, okay, and how we are taking measures to ensure this happens. Second thing we discussed today was the distance diagnosis, a very sophisticated program to make available a proper diagnosis to patients from around the world, from their own houses, from their own offices. The third thing we discussed was the advanced direct hair distribution, the best technique by far, I must say that, today. And finally, the virtual reality program that for the first time again in the history of hair restoration, doctors and nurses will be able to be trained, and administrators, some parts of it, on a long distance or in a distance virtual reality sophisticated training program. We had one more innovation, which Professor Gotsarelis introduced, how to prolong the anagen phase. This is also a new era, and we have a research by a group of scientists that are working on how to see beneath and above the skin. Angela, we present that in September, because I think now it's too late for today, but on September 1st, on the next one, we can also add this, this presentation, how or can we see beneath the skin? So, but by September 1st, we will have the answer.
That's great, okay.
And September 1st is the next DHI webinar.
So thank you all so much for your participation. We are glad to receive your queries or your questions that you may have through email. You can send us your queries at info@lita.com, and we will